Ambien belongs to a class of drugs called sedative and hypnotics. Ambien is available in 5 mg and 10 mg tablets. The active ingredient of Ambien is Zolpidem. What is Ambien tablet and what is it used for? Zolpidem is used to treat a certain sleep problem in adults. If you have trouble falling asleep, it helps you fall asleep faster, so you can get a better night's rest. It acts on your brain to produce a calming effect. This medication is usually limited to short treatment periods of 1 to 2 weeks or less. How to use Ambien? Take Ambien exactly as prescribed by your doctor. Follow all directions on your prescription label. Never take this medicine in larger amounts, or for longer than prescribed. Do not share this medication with another person, even if they have the same symptoms you have. The recommended doses of Ambien are not the same in men and women, and this drug is not approved for use in children. Take this medication by mouth on an empty stomach as directed by your doctor, usually once a night. Since Zolpidem works quickly, take it right before you get into bed. Do not take it with or after a meal, because it will not work as quickly. Do not take a dose of this drug unless you have time for a full night's sleep of at least 7 to 8 hours. If you have to wake up before that, you may have some memory loss and may have trouble safely doing any activity that requires alertness, such as driving or operating machinery. Dosage is based on your gender, age, medical condition, other medications you may be taking, and response to treatment. Do not increase your dose, take it more often, or use it for longer than prescribed. Do not take more than 10 mg a day. Women are usually prescribed a lower dose, because the drug is removed from the body more slowly than in men. Older adults are usually prescribed a lower dose to decrease the risk of side effects. If you suddenly stop using this medication, you may have withdrawal symptoms. To help prevent withdrawal, your doctor may lower your dose slowly. Withdrawal is more likely if you have used Zolpidem for a long time or in high doses. Tell your doctor or pharmacist right away if you have withdrawal. Though it helps many people, this medication may sometimes cause addiction. This risk may be higher if you have a substance use disorder. Take this medication exactly as prescribed to lower the risk of addiction. Ask your doctor or pharmacist for more details. You may have trouble sleeping the first few nights after you stop taking this medication. This is called rebound insomnia and is normal. It will usually go away after 1-2 nights. If this effect continues, contact your doctor. Here are some things to know before using Ambien. Before taking Zolpidem, tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. Before using this medication, tell your doctor or pharmacist your medical history, especially of kidney disease, liver disease, mental mood problems, personal or family history of a substance use disorder, personal or family history of sleepwalking, lung breathing problems, a certain muscle disease. The effects of this drug can last even after you wake up the next day. If you did not get 7 to 8 hours of sleep or took other medications that made you sleepy or are more sensitive to this drug, you may feel alert but not think clearly enough to drive. You may also experience dizziness or blurred double vision. Alcohol or marijuana can make you more dizzy. Wait at least 8 hours after taking this drug before driving, and do not drive, use machinery, or do anything that needs alertness until you can do it safely. This medication may also increase the risk of falls. Avoid alcoholic beverages. Talk to your doctor if you are using marijuana. Older adults may be more sensitive to the side effects of this drug, especially dizziness, confusion, unsteadiness, and excessive drowsiness. These side effects can increase the risk of falling. Before having surgery, tell your doctor or dentist about all the products you use. During pregnancy, this medication should be used only when clearly needed. Babies born to mothers who have used this drug late in the last 3 months of pregnancy may develop unusual sleepiness, trouble breathing, unusual limpness, or withdrawal symptoms. A small amount of this medication passes into breast milk and may have undesirable effects on a nursing infant. Get medical help right away if you notice any unusual symptoms in your baby. What are the side effects of Ambien tablet? Ambien may cause serious side effects, including abnormal thoughts and behavior, hallucinations, worsening of depression and suicidal thoughts or actions. Memory loss, anxiety, severe allergic reactions. The most common side effects of Ambien are drowsiness, dizziness, diarrhea, grogginess or feeling as if you have been drugged. After you stop taking sleep medicine, you may have symptoms for 1 to 2 days such as trouble sleeping, nausea, flushing, lightheadedness, uncontrolled crying, vomiting, stomach cramps, panic attack, nervousness, stomach area pain. If this video was helpful for you, please like the video and subscribe to the channel for support. I wish you healthy days.